So Catherine, lots more folks are coming in. So we are going ahead with getting started with today's webinar. We welcome you to introduce yourself. You'll find a chat window in the bottom right of your screen. Welcome to write where you're from and also what healthcare gamification question is top of mind for you. What questions have you faced or challenges that you're facing? We will actually take the time during this presentation to talk to some of those, either real time, right during the session. We'll also have a Q&A time afterwards. So we encourage you, as thoughts come to mind, or if you just want to say, yes, I agree with that, or no, I haven't seen that in practice, tell me more, please feel free to do so in the chat. This is a very interactive time. You see we've got Maurice from Atlanta. Welcome. Thanks for joining us today. So with that said, I'll kick us off with our introduction here. Today's topic is gamification for healthcare, talking about designing programs that motivate long-term behavioral change and patient engagement. If you could go to the next slide. Our key speaker today is Villar. He's our digital architect at Calcium. He serves as an adjunct professor at UW Stout with background with an MS in information and communication tech, has been founder of many companies and also serves on a number of boards. Great kind of innovative mind, and we would love just to welcome you, Ray. Thanks for presenting all of this content, and I'll just remind everyone, as we go through this, please feel free to jump in with questions in the chat box, and we will tackle them as best we can during the presentation, as well as during a dedicated Q&A time afterwards. So Ray, thank you so much for joining us today.
Thanks a lot, Jen. And thank you everybody for joining us. So now gamification, as most of you probably already know, have been motivating gamers, shoppers, employees, and students, for decades now. In fact, gamification, which is part of behavioral science, and behavioral science, the study of behavioral science started over 100 years ago and was part of the evolving field of early psychology. Gamification itself, as many of you know, has been around since the early days of mass marketing. Now, here's the interesting thing: is that with the rise of our app economy, which really started only in the last 2 decades, you've really seen gamification take off. And so it's becoming more prevalent now in many areas. And in some fields, it's not just prevalent, it's table stakes. You cannot succeed. You can't even operate without having a clear gamification strategy. And that's definitely the case with gaming. If you're creating any sort of gaming or entertainment app, but also education. More and more we're seeing in a lot of the ed tech apps and solutions we're seeing out there, gamification really being integrated into the whole learning kind of environment that's being used by a lot of ed tech apps. And it's also increasingly common, and I would say it's always been there really in many ways, among in the retail and also among employers in the employment industry. And going on to the next slide. Now, the thing about gamification, I do want to kind of point out 3 specific areas where it's already so well established. One, and we're all very familiar with this, is shopping. How many of us are part of loyalty rewards or frequent flyer or frequent user programs? My wife and I book almost all of our vacations through hotels.com. Because for every 10 nights and this is not a plug, by the way, but for every 10 nights we book on hotels.com, we get a free night. And then also, employees, the employers have been using gamification for quite a while. I used to be in sales, by the way, and I remember, our sales director would sometimes come in, and this was a long time ago, would come in and post $200 on the bulletin board and say, look, first person make close 3 deals today gets a $200 bill. And this was admittedly over a decade ago. But there are other examples that are becoming more and more prevalent and really the norm today. One is the employee of the month option. Or feature that a lot of companies use, and we use it here at Calcium as well. I also ran into a company that I used to work for. They instituted unlimited PTOs, so unlimited paid time offs. Their whole rule was that, look, as long as your job is done, you can take as much time off as you need. Now, the thing with both of these, employee of the month, unlimited PTOs, it doesn't really cost companies any money. And that's the beautiful thing about gamification is it doesn't always mean, paying people or rewarding people with something something of monetary value. It can, and then sometimes, that actually does work better. But it oftentimes doesn't really cost a lot of money to get people to change their behavior. Or to do something that you need them or want them to do. There are drawbacks, with some of these gamification tools or strategies. For example, unlimited PTOs. My fellow employees and I quickly realized that it wasn't as great as it was made out to be, because there was always work to be done, for one. And for secondly, with the problem with unlimited PTOs is if you do leave, you don't get any credit, for any unused PTO. So that was just, there's always, you always have to kind of look at the different angles involved there. Now, as I mentioned before, too, in education and ed tech, there's been a huge drive, especially now, but, implementing more gamification strategies in ed tech. But gamification has been around in education for decades. And I don't mean to date myself, but I remember being motivated by stars and medals, when I was in grade school. My son last month came home with a certificate saying that he was the most welcoming student in his pre-K4 class. And he loved it. My daughter, who's in fifth grade now, last year she came home with best improved reader, a certificate, a simple certificate, really drove her to read even more. And then I remember from my own experience in eighth grade, one of the cool things that they did was that, they actually had a little gaming area where they had board games. And if you finish your task early or, you got done, you did an especially good job, you and whoever else were in that group could go and spend, half an hour in this game area. Just have fun. And it was, not quite recess. It was all internal, but it was really a nice reward to motivate some, behavioral changes. And that really is at the heart of gamification. Now, with all of this, that kind of begs the question, and I've been in the health tech industry for over a decade now, but where is gamification in healthcare? And if you think about it, a lot of the crisis, a big factor in the crisis that we have here in the U.S. Healthcare industry and our environment is that even though we spend a lot of money on healthcare in the U.S., we're not getting much healthier as a population. And one of the big factors there that's recognized by both clinicians and providers is that we need more patient engagement. We need people, we need individuals to begin to take ownership of their health and make long-term changes, to improve their health and the health of the population with that. So almost more than almost any industry, healthcare needs gamification. And we're oftentimes left wondering, where is it? Why aren't we using it more? But it probably helps to start by first identifying what gamification is and isn't, because I think that's part of the problem here is that there's a lot of confusion about what gamification means. Okay, first of all, gamification is not just about games. Yes, games are oftentimes involved with gamification, but that's not really at the core of gamification. Also, it's not about game theory. Somebody brought this up to me. No, it's not about game theory. Game theory is more of a theoretical framework for how to win against competitors. But in healthcare, it's not about competition. There's not a competition between patients or between patients and providers. In fact, it's the exact opposite. We actually, instead of pushing for competition between parties, we are actually trying to promote collaboration, better communication, better engagement between patients and providers. So that's what gamification isn't. And lastly, gamification isn't, as someone humorously pointed out recently, it's not about gamma rays. It's not about using gamma rays to turn everybody green or into the Incredible Hulk. No, gamification is about design and programming to elicit a specific behavior. Okay, how do you design programs? both online and offline. So it doesn't all have to be online, that gets users, or specifically gets your patients, to adopt a behavior, a healthy behavior you're seeking or you're promoting. So, the examples I gave earlier about hotels.com, I mean, that's a simple gamification program. Those loyalty rewards in general are simple gamification programs that encourage me to now, without even thinking, whenever my wife and I are looking to book a vacation or getaway, we automatically go to hotels.com. Just because, through gamification, we've learned that, hey, it actually pays to go there because, every couple of years we get enough for a free weekend somewhere, because of, how much we use it. Now, admittedly, during the COVID crisis, we have not used it. We've hardly used it. We used it once or twice for our own vacation, but that's it. Now, it does bring up a question, an issue here that, and some of you may actually have already, brought this up, is gamification manipulative? And we're going to actually have a slide later that talks about the ethics in gamification. But let me give you a preview with a quick answer. And the answer is yes, gamification is manipulative. But, just like paying patients to be part of clinical trials is manipulative, and so much else that we use. Just like the negative reward of forcing patients to pay more when they're out of network. These are all manipulative, but the issue is, when does it become unethical? And we'll talk more a bit about that later. Now, here's the truth of the matter. Many gamification programs fail, at least many attempts at gamifications fail, especially outside of gaming apps. I found in edtech apps, and most of this, if not all of these fails, come from a basic lack of understanding about gamification. And that previous slide that we just reviewed really points to one of the issues, that people don't really fully understand what gamification is. When you talk about gamification, most people just think, oh, add games and that'll get people engaged. That's not what gamification is about. Yes, sometimes games are involved, but gamification is about changing behavior, especially in healthcare. And so, one of the key factors, behind a lot of these failures is that people don't understand that one size doesn't fit all. Okay. Now, we all probably have taken those personality exams, tests like Myers-Briggs or DISC or the Culture Index. There's many of them out there today that a lot of employers and a lot of organizations use. And from that, I think we all understand that different individuals respond to different motivators. And that's the key thing to really designing a successful gamification program for healthcare, but actually for any field. Now, in gamification, one of the more popular models was put out by Andres Marzuski over a decade ago now, almost 2 decades ago, where he kind of outlined 6 basic gamification personas. Now, obviously there could be more, but this was a really good model that a lot of gamification designers have embraced. And these 6 include socializers, free spirits, achievers, philanthropists, players, and disruptors. And don't worry, we're going to go into detail about them right after this. But but one of the key things about this model, and any model you really want to use, but this is a really helpful model for gamification, is that successful gamification design means understanding and prioritizing these patient personas, because some patients, will respond to simple rewards. Others actually do better in community with support groups, and others are best, are really driven to learn for themselves and develop their own programs. Okay, and hopefully with guidance from the provider and the healthcare provider, but not always. So again, understanding these 6 personas helps us develop, more successful gamification programs. Whether it's for a healthcare app or any, or for a medical group trying to improve, the adherence rate of their diabetes patients. Understanding these personas is going to be key to have successful gamification programs. So let's kick it off. The first one in Marzuski's list are socializers. Now, socializers, and with all of these personas, I'm going to be talking about introducing four items. One is what are their high-level motivations, and then two, I want to zero in on one of their wants and desires, and then from there get to what's the best approach or what's a recommended approach for healthcare providers who want to motivate these types of personas, these patients with these kinds of personas. And then lastly, we'll talk about some examples for each of these persona types that you may want to consider or we've seen out there already. So with socializers, these individuals are really motivated by a desire for relatedness and community. Some people may mistake them for introverts, but they're not all, extroverts, but they're not all extroverts. They do want to interact with others and do desire that, have that desire to create social interactions. This is a big driver for them. And so the approach for the socializer persona is to encourage group activities, social learning, and knowledge sharing. So some common examples that are already out there are, for example, are moderated social media groups for example, for hypertensive patients or for cancer patients or for diabetes patients. These are social media groups. Oftentimes they're private, not always, but they're usually moderated by, a nurse or practitioner or a specialist, trained in that field who can moderate the questions and discussions in that group. Now, the beautiful thing about that, again, is it doesn't cost a lot of money. Yes, there is some personnel time, but what it does is it really encourages, people to, especially the socializers, to get more involved in learning more and really managing whatever disease, whatever condition they're dealing with. A big example I don't have here, I haven't listed here, of the socializer approach or strategy for socializers in health is Weight Watchers. If any of you have ever been to Weight Watchers, and I admit I was actually part of Weight Watchers about 8 years ago, and it's a great program, by the way. But one of their key tenets is they have weekly meetings that they really encourage people to attend. They encourage their subscribers to attend. Now, Weight Watchers actually uses other gamification strategies in their multifaceted program, but that social element is a key part for of success for their subscribers. It doesn't work for everybody. I wasn't a big fan of it because, again, I'm more of an introvert, but at the same time, I could see the value of it, the value of sharing and support. Another example kind of along those lines are, other in-person meetups for, other chronic conditions for diabetic patients. Now, let's be honest. This could traditionally be called support groups, and yeah, they are. Support groups fall into this bucket of things we could do for socializers both offline and online, to again allow them to interact more with others with similar challenges and conditions. Now, the second persona type that in Marsuski's model are free spirits. Now, these individuals are driven by a desire for autonomy and discovery. They especially want to create through exploration. So how do you channel that for healthcare? How do you channel those health spirits to improve, to take ownership and do more for their health? Well, one of the recommended ways is to provide opportunities for learning and allow patients to help develop their own care plan. So, a vivid example of this is a pathway where they can learn more about their allergies and then develop their own allergy action plan. There are, as most of you already know, there are already templates for creating allergy action plans. And oftentimes, providers or allergists will just go ahead and create it and, and give it to, to somebody and say, all right, this is your allergy action plan. But with free spirits, they actually want to learn more about their allergy, get to, in a way, almost master this particular element, and then create their own plan. And so the key here for free spirits is they need to be part of developing their care plan, whether it's for allergies or diabetes or hypertension, whatever it is. They have a desire, and then the way to really motivate them is to get them more involved with learning more about their condition, but also designing the care plan that works best for them. And along the way, one of the other kind of elements that help with these free spirits are personalization options, especially on digital platforms. The ability to add avatars, the ability to to actually put in a nickname instead of their just a regular name. The ability to even personalizing the color of their profile allows, those personalization options are small features that work well for free spirits. Additional things too that free spirits like are Easter eggs and trivia. And if you're not familiar with the term Easter eggs, those are little surprises that, along different pathways or in your app where, the user who stumbles on that and opens it will learn something new or get something new. And those are things that free spirit really enjoy because they find something new, they discover something new, oftentimes by happenstance. Those are the free spirits that in Marzuski's model are really driven more by exploration rather than just simple, rewards and awards or even being involved with other people. It's that personal discovery is a big part of their motivation. The third persona in Marzuski's model are achievers. Now, achievers actually they're motivated by two interconnected things. First is they're motivated by the desire to master a subject or skill, and secondly, they're motivated by a desire to be recognized for having mastered that subject or skill. So there's two parts there. So they want to improve themselves. They want self-improvements and they want to overcome challenges. And they also want to be recognized or get some form of recognition, for that. So how do you do that? So what's the best approach for them? Well, recommended approach is to encourage that competitive spirit they have, that spirit for, in many ways, this is more an inner competitiveness, competing against themselves. By encouraging that with with rewards, mentions, and also badges. So for example, certificates and badges really are for people driven, who have these achiever personas. I told you earlier about my son, my 5-year-old son, who's currently finishing pre-K 4, and getting that certificate saying he was, the best, the most welcoming, student in class. He loved it. I mean, he's, it didn't cost anything, but for him, that just drove him to do better. To be friendly, to be even more friendly to new classmates, especially. Other kind of tools or methods for motivating these achievers are award points and coins that are tied to specific pathway milestones. So when they finish a particular pathway or they finish a training program and they get points or awards or rewards or prizes or some sort of certificate for finishing, all of that is really kind of ties together that achievement, but also recognition for that achievement. And then a really big example of this too, especially for those who are very competitive, are leaderboards. Whether it's a leaderboard for steps taken for the week or the month, or BMI improvement for a 1-month cohort. How many people were able to lower the BMI by at least 3%, that kind of thing. These are these kind of leaderboards not only highlight people's achievements, but it also kind of drives their external competitive spirit as well. Now, the fourth persona in Marzuski's model are philanthropists, better known as altruists or, yes, do-gooders. Now, the motivation with philanthropists is really a desire to find meaning and purpose with their lives. And their primary want is to be altruistic and to help other people, among other things. But that really is the big plus. Now, do they want to be recognized for that? Some do. Others, it really is very much an internal value model for them. Now, what's the best way to approach them? Well, it's not a big surprise that, and it's already been done for decades by a lot of organizations and healthcare providers, which is to promote opportunities to be volunteer leaders and sharers, especially for specific health challenges. One example, just to kind of put one out there, is a COPD patient advisory board. it won't really cost you anything. But with with something like that, and it doesn't have to be COPD, it could be a diabetes or a hypertension patient advisory board. This is where you bring patients in to advise your group on the effectiveness of your program. And it doesn't have to cost you anything for that. And also, and to really make sure that they're driven to make those improvements in their own lives, is that that you lay it out there that to be part of this advisory group, they must go through these steps. They must have actually gone through that journey themselves. And in a similar vein, you can award patient expert badges on your app or platform, as learning certificates. That as somebody who has diabetes, has gone through all the diabetes orientation programs and really made some great efforts, and actually has shown how to make their own personal improvements, they can earn badges that, and then in whether it's in meetups or forums, they can be somebody that other individuals early on in their journey can look to for advice or guidance or tips, or just a regular patient to patient discussion. And then lastly, there's training for community health volunteers. Whether it's, if you need additional volunteers for an outreach program, to tackle the heightened obesity or diabetes or hypertension trends in your community. This could be a way to really motivate these philanthropists, these altruists, to get more involved, not just with the community, but with themselves, to really master their own health so that they can share their learnings with others. The fifth persona in Marsucci's model are players. These are individuals who are primarily motivated by awards and prizes, and they want to collect as many rewards for themselves and their family as possible. Now, I want to caution you here, do not underestimate these individuals. Especially, do not think that they're shallow and they just want prizes, or they want toys, or they want awards. If you do that, you miss the mark, and you miss the understanding of what really drives these players, because it's actually a bit more complex than that. Players, one of the things about players is that they actually, especially the better ones, don't just want to collect as many rewards, just for the sake of collecting rewards or prizes. They actually have a bigger purpose for it. They actually, are looking for. They choose rewards and prizes or reward systems that actually delivers real benefits for them and their families. So what the approach for these individuals, for these personas, is to create a reward system, one that's well known and has clear messaging for winning awards and prizes. But really the thing is to tie it in with something that will actually benefit them. Not just give them more coins or tokens or certificates, but actually help them to make, that will actually give them an advantage in life or make them better. And so I'll give you an example of that. Our reward credits, not, for local massage therapists, spas, or gyms, or, healthy prizes such as bikes and exercise machines. These, so basically they're not just collecting awards, coins, or tokens, or badges, or whatever, for the sake of collecting those. They're getting them to earn something healthy, or something that will help them improve their health. Or it could be a Fitbit watch, an Apple Watch, or a Fitbit device. Whatever the case may be, you want to reward, use the credits, design the credits to actually, so that they can use it to improve their lives. And that's the thing about players. They're not just there. Even on the surface, it may seem that they're just interested in getting as many coins and awards and prizes as possible. It actually goes beyond that. And you have to understand that when dealing with players, and there's a lot of players. And in fact, most people have a little, not most, but the majority of people have, a bit of this player mentality in them. And so you have to be aware that it's not just about collecting coins or prizes or awards. It's about collecting them for a higher purpose in a way. Now, the last persona in Marsusi's models is what he called disruptors. I kind of prefer to call them as innovators, but also troublemakers, because they can go either way. But the motivation with disruptors is that they want to innovate and change things. They especially want to disrupt the status quo, especially a status quo that they see is not working well and that needs to be fixed, because they want to disrupt that status quo to fix serious problems. And guess what? Healthcare in the U.S. is probably in need of these disruptors more than anybody. So how do you harness disruptors, not only to help our system, but to help themselves to make those behavioral changes that will improve their own health, but also in a way also help us to improve our community and population health? One approach is really a recommended approach is to encourage as much feedback, ratings, and suggestions and input from disruptors as possible. Instead of having them blowing up, give them avenues for blowing off steam, but really, but also help, as in real life, or at least during the industrial age, we use steam to power so much of our industrial growth. The steam that they blow off can also power a lot of positive changes in our healthcare industry. Some examples of this is to automatically give everybody the opportunity to rate all content and tools you provide, not just satisfaction ratings. I know a lot of providers are very focused on improving their patient satisfaction ratings because they're on the hook for that. But don't be so focused on that you forget about what's really underneath patient satisfaction, which is really motivating patients to take ownership of their health and achieving those optimal or better health outcomes. Another example is allow individuals, allow your patients to submit ideas and then vote on ideas for better patient engagement and care, or improvements to your processes, or improvements to your medical group or hospital or health system. So one of the apps that I used to use a lot, and a lot of small businesses use this, is called HubSpot. And we also use Salesforce today. And with both of these, and a lot of apps like this in business today, they have forums that users are allowed to suggest ideas for new features, new functions, new fixes that they'd like to see. And then all the users are allowed to vote on which one is most important to them. So every month, for example, HubSpot, which is a very popular marketing automation tool for small business, they put out an announcement that lets everybody know, hey, these are the 3 features that got the most votes, and so we're prioritizing this in our next iteration. And you have a lot of apps and a lot of tech companies that actually do this. A third example approach of gamification approach for disruptors is to give them an opportunity to break your app, or break your tools, or break your programs that are being considered. So are you looking for a pilot program? Are you looking for to try out a new app or a new platform? These disruptors are great to really break it, to find out where its fail points are. They're really ideal for that. All right.
We have a great question from Leanna that kind of fits in there. She's curious about Maslow. I'm assuming the hierarchy of needs, how that works with these personas.
That's a great question.
Yeah, and I'll finish. Yeah, she makes a couple other statements there. She said the people she works with are so overwhelmed that I would call them non-players. And don't take the comment as negative. Just wondering how to help get people in the game.
Yeah. So as far as Maslow's hierarchy of needs, which by the way, it's I think it's celebrated. Was it like its 100th anniversary recently? I forget. But the thing about that is it actually is part. That model is actually part of this. Is a foundation for these 6 personas, because in many ways all of those personas have to go through those needs in one way, in one level or another. So the altruist would probably be higher up on Maslow's hierarchy of needs, whereas the players will probably be more of really looking at the base level, trying to get those basic things that they feel like they need to. I'll give you an example. You have people who are trying to make ends meet, and when they see a gamification for a rewards program that, if they do these things, they'll be able to get some membership to the gym, for example. If they participate in this program, they know they need that to improve their health, and if they can put in the time here, they'll get that that basic need, at least on a healthcare level, need for that. So that's very important as far as the integration between that. Now, as far as being very busy, and to the point that nobody has a chance to really play. I think we're all very busy, and here's the thing about this gamification, these gamification models, and you see it at play, by the way, in a lot of games. You have what are called idle games now in the gaming industry, where it is geared for people who don't have a lot of time. But with them, especially with them, gamification becomes critically important. And in a later slide, I'm going to bring up a case study of Duolingo that kind of points directly at that, at people who have very little time. How do you get them to to make this part of their daily ritual? Hopefully that helps, but if not, we can discuss this a little bit further. All right, now kind of continuing on this. Now we've gone through all those 6 personas. So, some of you may be asking, well, how do I know which persona to use for a patient? Well, I kind of have 3 answers for that. One is you can ask them. It doesn't hurt to ask them. You can ask patients whether or not they would find more motivation or would like to participate in more of this this achiever model where they go through pathways to learn more and develop their own allergy action plan, for example. Or you could ask them if they'd be interested in something along the lines of these social groups, to see if they're socializers. But the second part is, you don't have to ask them. You can allow them to self-select. Set up the program and see who gravitates to those programs, because that, in many ways, people's own persona will drive into where they want to be involved in. And then also, it's important to understand that, most of us, are not, really don't fit, perfectly or completely into one persona. Most of us are in 2 or more of these gamification personas. We're motivated by different things at different points of our lives, and also at different times of the day. So understand that you don't have to necessarily pick one, for each individual. It's actually, in a way, it's almost like creating a buffet menu, a limited buffet menu that allows people to self-select what's best for them, what they find is most effective for them.
One great comment, Ray, tied into that. I know we want to keep on our time, but a good comment, a question from the audience from Liana. Is there a screening tool? I'd love to include it in the gamification app. The app changes dependent on the persona.
Yes, there are. I mean, and Denise will actually talk a little bit more about how we use, our pathways. But and in our pathways, you can use different kind of questions to screen people. So you do have different opportunities for that, depending on the app and platform that you're using. But that's actually a great point, though, is that you can actually have that screening kind of question either in person or using an app to find out, to kind of invite people to choose which pathways they want to use, or which combination of pathways or options, that they want, tools that they want to use. So, some people, you want to design it, to learn more about something, but others, it's more about getting them to do something every day. In fact, that's where this case study of Duolingo I just mentioned, that I want to bring up, because one of the reasons too that, and one of the challenges or reasons that we haven't seen gamification work as well in healthcare yet. I mean, it's starting to work and it's starting to be applied, but it's also the challenge of understanding that, at the end of the day, don't worry about personas. In healthcare, it's important that you understand these personas about what drives and motivates people as you design your programs. But when you start designing your programs, think about first, what behavioral change are you trying to promote, to create in your patients? That's where you start. And I bring up this case study of Duolingo. I managed to catch one of their co-founders at the presentation, the conference 3 years ago, and then I had a chance to speak with him afterwards. He talked about Duolingo, which, by the way, is one of the world's one of the top language learning tools in the world today. And they, from the very beginning, they embraced gamification in their design, in their entire platform design. One of the things that he pointed out is that, look, we approach it from the challenge of what are some things that we need our users to do, and how can we use gamification to achieve that? So one of the challenges that they had, and we'll find, and people in healthcare will find some resonance with this, is that to really learn a language, you need to practice it every day. The more days you miss using and practicing that language, the further back you fall behind in learning that language. So daily practice is important for language learning. And so what they did at Duolingo is first they eliminated the obstacles, the excuses that for language learning by breaking down their lessons to 5-minute lessons. So all you need is 5 minutes to do a lesson. Now you can do more than one lesson a day. You can do a whole hour of lesson. But if you only have 5 minutes, you can just jump on and do it. And then to the gamification element of that is then they create a daily streak award or program that tracked and then rewarded people for continuous days of app use and daily lessons. And it worked. It got people more, coming back every day. But then they hit this interesting crisis point. People who accidentally broke their streak, people had streaks of like 3, 4, 6 months long, and they missed it because they were on vacation and couldn't find internet access, or they just forgot, or they just got really overwhelmed at work and they had to miss a day. People started complaining and really were angry that, hey, I just broke my streak because it's something that wasn't my fault. That's what they would say anyway. There was a lot of people were distraught. But in this crisis, Duolingo found an opportunity. They rolled out a patch or this program that said, all right, you can repair your streak, or basically you can have a free day, to continue a streak without actually going on. But you have to pay for it. And so, this patch that they use to keep people, continue, this daily streak program, gamification program that encourage people to continue visiting every day, they actually use that to increase their revenue by requiring people to subscribe to their monthly subscription or pay a fee in order to fix a broken a break in their continuous days. And other approaches, other games have different approaches. So Zynga Poker, for example, which I use occasionally, they have a virtual slot machine that gives you chips that you can use in your poker games. And if if you go into the app at least 7 straight days, they'll multiply whatever awards you get 4 times. And then other apps will basically have tournaments that last only a week or 2 weeks long, and they run continuously. And you cannot miss a day in order to win that tournament. You have to be involved in it every single day. So these are just different, methods. But the key thing here is, as you start developing your gamification program, keep the personas in mind. But really, the starting point is, what behavior modification are you trying to promote? And with that, I kind of want to introduce Denise. We'll talk about some of the experiments and projects that we worked on here at Calcium. Denise? Oh, I think she's coming on.
Hi there. Yes. So at Calcium, what we've done is we've really taken a consumer-centric, outside-in approach to make sure that the app is clear and concise and meets those original needs, that it has some fun and rewarding aspects, as well as being intelligent and adaptive. So we use achievement badges. We use a My Health Index wellness indicator score, and we use secure sharing, things to build the community. And one thing that I just wanted to highlight in the next next slide, is where we've seen a lot of success and data around Leaderboard. So what we do is we run out challenges, which of course, attracts the achievers. And what we found is when we give a reward, we do get a high number of signups. But what actually gets people to continue moving and to continue competing is a leaderboard. So by combining different aspects of gamification, we're able to increase the desired outcome that we're targeting. So this is just an example of how we're weaving this in to hit multiple segments and really support those healthy behaviors within Calcium.
Awesome.
Thanks, Denise. And real quick, Ray, if we could go back to that other slide, Jason made a great comment. And that was actually a great segue, Jason, into what Denise was sharing here about gamification working well for some companies when they create step challenges. For example, 10,000 steps a day for X days earns you points, and you can earn gift cards or premiums. Mm-hmm. And one of the findings, Jason, that I'm glad Denise mentioned was those were, definitely a hook. And people continued, even with something like a leaderboard. People get surprisingly competitive when they start to see their name rising. We had a fun challenge even with our business development person was like, I got to get to the top there. So it's interesting how those rewards can hook, but also then continuing to tap into that dopamine with getting on the leaderboard.
Exactly. And kind of along that line of, another gamification case study I want to introduce is Healthy Wage. Now, some of you may have run into this. They were in the news a few years ago, and they've been around for a while. They're based out of the UK, and their concept is interesting. And that is, you pay, $50 to $100. You basically lay down in bed, and that you'll achieve a reasonable weight loss, not too much, in a specific period, and they do have a guidance kind of scale, that they use in Healthy Wage. And in return, you're going to get anywhere from 300 to 1,300, sometimes more if you succeed. And they do have tons, of success stories of people actually holding their Healthy Wage check for after winning, hitting their mark. So this is, again, another example of gamification at work, but I'm not a big fan of it, because one, there's little support, behind it. And the reality is, if you run the numbers on it, to be able to give away such a big prize, it's basically, the calculated payouts are based on the assumption and the reality that most do not succeed. Okay, it does, but what it does point is that for some people, that money that, especially for players, the player persona, that money or reward for losing weight, is a huge motivator. It's enough of a factor, but you figure if you run the numbers and how many people have to lose in order for the winners to get a significant bump in their wages, basically 90% of people on average will not make their mark. Okay, and there's another failure in Healthy Wage that I which I think is a really not the best use of gamification, and that is the focus is all about outcome, losing weight, which is great, by the way. It's great to lose weight. Many of us need to lose weight. I need to lose weight. But the key thing for healthcare is not so much that one solitary outcome, but it's also about making or motivating people to make long-term behavioral changes that will improve their health for the long run, so that they don't lose weight and then gain it back. That they actually make the changes to their daily lives that will actually make them, live better lives and longer lives and healthier lives. And I do have this slide here. I'm not going to take much. I'm actually not going to go into much details about this, but these are some strategies that, if any of you there use gaming apps, whether it's, card games or role-playing games or whatever, you'll see, you'll recognize a lot of these gamification strategies, whether it's creating clans or tournaments or social groups on Discord or Facebook. These are all common strategies in gaming apps. I'm not going to go through this. If you're interested in this, we'll be posting the videos, or you can email me and I can send you a copy of this. But I kind of want to start wrapping up by talking about the ethics of gamification. As I mentioned earlier, yes, gamification is manipulative, just as paying patients to be part of clinical trials is manipulative, just like using this cute cat picture to get cat people, cat lovers to feel cuddly is manipulative. But But that's not really the point. I think the point about, when we're looking at the ethics of gamification is how do we keep it ethical? The first, and I propose 3 rules for, keeping gamification ethical, especially in healthcare. And the first one is alignment. Your gamification strategy, it has to be aligned with the stated objective of your program. What that means is that if you're have the program is to improve adoption by diabetes, or adherence by diabetic patients, and the end prize should not be a gift certificate to a buffet restaurant or a bakery. It should be again, things that will actually help them in the long run, either within the app itself or other external rewards. The second is transparency. Be upfront on the purpose of your app, which is to encourage long-term behavior change. Stay upfront that the reason that this pathway, this program, is to help you develop long-term behavior change that will help you, that'll help you manage, not just manage your hypertension, for example, but also, but help you manage it for life and improve, live longer and healthier. And then lastly, it should be about the patient. The patient has to be first and foremost. And and what do I mean by that? Of course, you'll say, well, we all care about the patient health first and foremost. Well, yeah, but I've also seen gamification programs that try to get higher, app ratings or patient satisfaction ratings. That's not about the patient. That's about you, the business, the provider, the organization. That's not patient focused, and that is where you suddenly, start, crossing the line between ethical and unethical use of gamification in healthcare. So these are 3 rules I would propose as the 3 ways we keep gamification ethical, because gamification by its very nature is manipulative. We're trying to manipulate patients to take ownership of their health, to make those behavioral changes for life that'll allow them to live a longer and healthier life. The issue is, how do we keep it ethical? And, to close out, I do want to, last month during family night, my family and I watched this movie, Free Guy, which, by the way, I totally loved. I don't know if you've seen it, but it's available. It's streaming on HBO Max and Disney Plus now. Really entertaining, but as I watched it again, actually last week, my son wanted to watch it again because he enjoyed it. It's a great analogy for the power of and the need for gamification, especially in healthcare. In this movie, you'll see vivid examples of different gamification personas involved in among the players, especially. But just to give you a quick overview, the film's it's about a video game that incentivizes negative behaviors towards the characters, non-player characters in the game. And Ryan Reynolds is one of those characters, but because of AI, he becomes self-aware and he starts to counteract some of those violence with more positive rewards, earning rewards positively, and also leadership. So it's a really, it's a feel-good story, a lot of fun, and it's actually pretty original. So, but more importantly, to our point here, you really see a lot of these gamification personas and tools and tricks, are built into that movie, because that's how a lot of gaming apps are set up today, very heavily gamified. So bringing it full circle, how do we bring gamification? How to get gamification? Bring gamification into healthcare, or at least get greater healthcare adoption of gamification. I would just recommend gamification. I would just say that gamification doesn't need to be perfect. If you're trying to, launch a gamification program, you don't need perfection. Start small and just keep building. And just, but we just need to start, because as we all know, we are in the middle of a healthcare crisis in the U.S. We're not getting better, even though we're spending more money and developing more technology and apps. As a nation, as a population, we're not getting that much better. Sometimes we're getting worse. But what's missing there is recognize what many clinicians and providers already recognize is that, look, there's only so much that providers and money can do. At the end of the day, we need to get patients more engaged and more empowered to take ownership of their health. And that's where gamification can really contribute strongly. So with that, I'll turn it over to Jen for our Q&A.
Thanks so much, Ray. And also thanks, Denise, for jumping in. We didn't get to introduce Denise earlier. Denise is our director of product and has been instrumental in implementing a lot of the behavior change and learning and testing that has happened to get our app to a very successful place. So thank you, both of you, for jumping in and participating today. I see some folks might be submitting questions. We did have a couple earlier questions that I wanted to include, one of which was how to measure the effectiveness of gamification programs.
That's a great point. Great question, Jen. And I would say, and I would kind of hark back to what I said earlier, when you're starting your gamification program, have a specific behavior challenge that you want to change. That and that becomes your benchmark or your standard against which you measure your gamification program. Look, if your big challenge, for example, is to get more of your diabetes patients to finish their onboarding, their orientation programs, and actually make real changes in their lives, that trackable changes that every day you see that they're taking their medication, essentially, really strict adherence to their diabetes care plan, then that becomes your metric. Is that, all right, you already know right now, probably to some extent, how well or not well your diabetes prevention or management programs are working. If you design a gamification programs to try to improve that, that's your benchmark. You measure how much you've improved over where you're currently at. And so again, it starts with, what are you trying to improve? What behavior are you trying to change? And you probably already have benchmarks, and then you measure your improvements against that benchmark.
Great. Thanks. And one of the things to that question is, we've seen improvements in A1C levels by introducing some of these practices, which you'll share more of. Leanna had a question about sharing the screening tool. Definitely, we can follow up with you after this to get you some examples and a little more information there. I think we're almost to the time. I think we had one short question that I wanted to fit in before we kind of wind up and wind down, was just a question around instituting gamification programs, and does that mean retraining our staff?
Yes and no, but it actually, it's more about retraining some of your patients, and allowing your program to do the training. So yeah, there'll be some retraining of the staff, especially, and one way to do that is really to have them walk through the gamification programs themselves, and see how it works. But it's not going to be a really huge lift, especially if you have if you have an app, for example. You can show them through a quick demo how it actually works, and then really the big training is the big question is, look, if you have a pathway for this gamification already built out, the big challenge then is, how do you train your staff to get your patients to the first step in that pathway? How do you get them get started on that pathway? And that's really where the focus of your training will probably be on. The rest of it really is just another tool to achieve a specific behavior change that you feel you need in your population.
Great. Thanks, Ray. I think we can start to go, to the next slide, if you don't mind.
Oh, yeah.
Just kind of wind it to a close. So one of the interesting pieces, we talked about gamification here, but on the next slide, another key piece of that is using data to help enable better health decisions. So how can we take, the connected devices that folks already have, they're tracking their steps, to somebody's earlier point, they're tapped in, they're checking their blood sugar levels. How can you then drive improved outcomes? And by marrying all of these techniques and findings together, creating this consumer-centric approach. So, patients are patients when you see them for 8 minutes, a visit or whatever that amount of time is, but they are engaging in these tools constantly. So, our Calcium app actually takes all of those pieces together and makes kind of some magic happen with helping drive things like improved outcomes around A1C, improved, number of steps by using leaderboards and challenges and these approaches. So if you'd like to check out more, feel free to reach out to us. And also we'll be following up with a recording of this webinar. And feel free, reach out. I believe Ray posted his email address here. So thank you so much, Ray, again, and Denise, both of you for joining and sharing your knowledge and insights with us today. And thanks to all of you for taking time out of your busy days and weeks to connect with us. So thanks so much, everyone, and have a great rest of your day.
Thanks, everybody.
Thanks, everyone.